What if I told you that the way most older men masturbate is silently weakening their erections, damaging their prostate, and increasing their risk of sexual disconnection without them ever realizing it? And what's worse, no one is talking to them about it. Hi, I'm Dr. Rena, a men's health specialist with over 30 years of clinical experience helping older men reclaim their energy, circulation, and intimate confidence. I've worked with thousands of men over 60. Husbands, veterans, grandfathers, many of whom came to me feeling confused, frustrated, and ashamed of what was happening to their bodies. They weren't sick, they weren't broken, but they were unknowingly making simple mistakes during masturbation that were costing them dearly. See, we've always been told that masturbation is safe and healthy, and in many ways, it is. But after the age of 70, the rules change. Your circulation slows. Your nerve sensitivity shifts, your hormones fluctuate. What used to work may now be silently sabotaging your health if you're not aware of how your body is aging. In this video, I'll reveal 4 masturbation mistakes men over 70 often overlook, and the real price they pay for them. These aren't myths, they're medical facts. And in mistake number 3, I'll show you the habit that's secretly weakening your erections every time you do it. Let's begin. Before we dive in, if you care about protecting your sexual health and staying strong as you age, go ahead and hit that subscribe button and turn on the bell so you never miss another video made specifically for men over 60. And if this message speaks to you, type 1 in the comments. If not, type 0. I'm here to serve you better. All right, let's get into it. The first mistake I see far too often, and it's more common than you might think, is something I call the quick fix habit. It happens when men rush through masturbation, treating it like a task to get over with rather than an experience to be present for. And while that might seem harmless on the surface, especially if you've done it that way for years, the truth is, this habit could be silently putting your heart, your erections, and even your emotional health at risk. Let me explain. Mistake 1, rushing to release, the quick fix habit. I remember a man in his early 70s who came to see me after his 3rd episode of lightheadedness and chest tightness following climax. He was scared. His blood pressure would spike, his heart would race, and he said he felt more drained after self-pleasure than after a brisk walk. He didn't understand what was happening. When I asked him to walk me through what he was doing, he said it plain and simple. I try to get it over with as fast as I can. This is one of the most common mistakes I see in men over 70. And it's more dangerous than most people realize. Rushing through masturbation might have worked in your 30s when your body was more resilient and forgiving. But after 70, your cardiovascular system is no longer operating at peak. Your nervous system processes arousal more slowly. Your blood vessels are more delicate. And when you go from 0 to orgasm in 2 minutes flat, your body treats it as a stress response, not a pleasurable release. This quick fix habit might feel efficient, but it's a silent attack on your nervous system and your heart. It spikes cortisol, throws off your blood pressure, strains your pelvic floor, and can even trigger arrhythmias in men with existing heart conditions. It's no coincidence that some older men feel dizzy or weak after climax. They're shocking their systems instead of easing into the experience. But the damage isn't just physical. Over time, this habit rewires the brain to associate sexual release with tension, not pleasure. Men who rush often report feeling empty afterward, a kind of post-orgasm sadness or mental fog that lingers for hours. That's not just emotion. That's a drop in dopamine, a crash in your parasympathetic nervous system, and a body that never got the chance to settle into pleasure. And then there's the impact on erectile quality. Rushing trains the body to perform under pressure, and pressure kills arousal. I've seen men who, after years of quick, hurried sessions, develop delayed erection response or even full-blown erectile dysfunction, not because of disease, but because they never gave their body a chance to engage fully in the process. One man told me, "It's like my body doesn't even want it anymore. I still have the drive, but I can't get there without pushing myself." That push, that pressure, that mental clock ticking in the back of your head, it's costing you your vitality. Here's the deeper truth. When you rush, you deny your body the benefits of full arousal. You cheat your heart out of the cardiovascular support it needs. You cheat your nervous system out of calm. You cheat your brain out of a healthy reward cycle. And in time, this creates a loop of frustration, fatigue, and detachment, both from your body and from any chance of emotional intimacy. So what's the price of the quick fix habit? It's high, dangerously high. We're talking about increased cardiovascular strain, rising blood pressure, reduced sexual satisfaction, potential emotional numbness, and over time, a gradual detachment from pleasure itself. All because no one told you that slowing down isn't just nice. It's necessary. But here's the good news. It's reversible. Your body wants to heal. Your brain wants to feel again. You just need to give it the right conditions. And that starts with changing how you approach pleasure. Now, if that sounds like a wake-up call, good, because it gets even more serious. The next mistake is something even more physically damaging, and it's right there in your hand every time you do it. Most men don't realize they're creating long-term nerve damage until the pleasure starts to disappear. Let's talk about that next. If you're still here and this message is resonating with you, type the number 1 in the comments so I know you're still with me. Your engagement means a lot. Now let's keep going. It's time to uncover the second mistake that could be quietly undermining your sexual health. Mistake 2. Using the wrong grip, the death grip problem. I'll never forget the conversation I had with a patient named Walter. He was 74, healthy overall, married for nearly 50 years, but he came to me with a quiet kind of desperation. He said, "Doc, I can get hard, but only when I'm alone. And even then, it just doesn't feel like it used to. My wife and I haven't been intimate in months, and I don't know how to tell her that my hand feels better than she does." He paused and looked down. It's embarrassing. And I understood exactly what had happened. Over the years, Walter, like so many men, had unknowingly conditioned his body to respond only to one very specific kind of stimulation: a tight, forceful grip. This is what we call death grip syndrome. It's when the hand, through years of repetitive, firm, high-pressure masturbation, becomes the only thing that can trigger arousal, erection, or climax. At first, it doesn't seem like a problem. In fact, it can even feel efficient. Quick, strong, reliable. But with time, this grip dulls the sensitivity of the penile nerves, especially around the glands. You become desensitized to softer touch, to partner intimacy, even to normal arousal cues. Your body starts needing more pressure, more speed, more friction just to feel something. And then, one day, what used to be enough isn't. You find yourself increasing intensity, fantasizing more aggressively, turning to more extreme visual stimulation, all because your nerves are no longer responding to anything less than artificial overdrive. And when you try to share an intimate moment with a partner, there's a disconnect, physically and emotionally. You may still care deeply, but your body simply doesn't respond the way it used to. What most men don't realize is that this isn't just a behavioral issue, it's neurological. Over time, high-pressure stimulation reconditions the sensory receptors in your penis, reducing their ability to detect lighter, natural, more organic touch. It also affects the brain. Your arousal pathways begin to rely solely on overstimulation, cutting off emotional connection from the experience. You're left chasing sensation instead of feeling. And the cost of that, it's heartbreaking. I've seen marriages strain because one partner feels unwanted or replaced. I've seen men spiral into shame, afraid they're becoming addicted to solo pleasure. I've seen men who once enjoyed rich, intimate lives retreat into isolation because nothing else seems to work. Physically, the long-term damage can include micro-tears in the tissue, reduced blood flow, delayed ejaculation, and in some cases, the beginnings of erectile dysfunction that can't be reversed with pills alone. But here's what hurts the most. These men didn't do anything wrong on purpose. They were never taught. No one explained that what worked at 30 might actually be hurting them at 70. No one told them that there's a better way. If this sounds familiar, don't feel ashamed. Feel empowered, because now you know. And that means you can change. Start with a softer touch, use lubrication, vary your rhythm, reintroduce sensuality, rebuild your connection to your body in a way that's not just about release, but about reawakening. And if you think that's the worst mistake older men make, it's not. Because the next one goes deeper, literally. It affects the muscles that hold your erection, support your bladder, and even control your climax. Most men don't even know these muscles exist. until they stop working. Let's talk about that next. Mistake 3. Ignoring the pelvic floor, the hidden erection killer. A man named Harold came into my office last year. He was 76, proud of the fact that he still walked every morning, kept up with his garden, and did most things on his own. But when we sat down to talk, he lowered his voice and said something I'll never forget. "I feel like everything down there is weaker, like I don't have control anymore. I dribble after I pee. I can't hold my erection the way I used to, and when I climax, it's barely anything. It used to feel strong. Now it just fizzles." Harold wasn't alone. What he was describing is something I hear far more often than I should. And it almost always ties back to one thing that men rarely pay attention to: the pelvic floor. Most men are never taught about these muscles. The ones deep inside the base of your body that support your bladder, your rectum, your prostate, and yes, your penis. They're like a hammock of strength holding up everything you rely on for sexual function and urinary control. And with age, just like any other muscle, if you don't use them, they weaken. What many older men don't realize is that the way they masturbate can either strengthen or completely neglect these muscles. Most lie flat on their backs, completely passive, letting the motion of their hand do all the work. Over time, this creates a dangerous pattern. The pelvic floor stops engaging, blood flow becomes sluggish, and the supportive muscles lose tone. What does that mean for you? It means your erections become less firm, your stamina fades. You might start leaking urine, you struggle to finish, or when you do, your climax is faint, not the powerful release it once was. And over time, this deterioration creates a vicious cycle. Weak muscles lead to weaker performance, which leads to less confidence, which leads to more avoidance. And the body shuts down what it's not using. I had one man break down in tears in my office because he felt like his manhood was slipping away. Not because of disease, not because of trauma, but because no one had ever told him that his sexual strength was tied to muscles he didn't even know existed. And the cost of ignoring your pelvic floor, it's more than just physical. It's the slow erosion of your identity, your confidence, your ability to feel connected to your body and your partner. It's that moment when you realize something has changed and you don't know how to fix it. But there's hope. These muscles can be retrained. You can reactivate them. And yes, even in your 70s and 80s, I've seen men regain firmness, control, and pleasure simply by learning how to use these muscles again. Seated or standing positions during stimulation, gentle pelvic contractions, and awareness during climax. They all help bring life back to a part of you that's been neglected for too long. Now, if you're starting to see how these habits are adding up, you're not alone. And if this third mistake shocked you, the fourth one might cut even deeper. Because it's not about your body this time. It's about your heart, your emotions, and the kind of loneliness that creeps in quietly when no one is looking. Let's go there now. If you're still watching and these insights are striking a chord, go ahead and comment the number 1 below. It lets me know you're here and still with me. Now, let's keep going and dive into the fourth mistake that many older men overlook, often with painful consequences. Mistake 4. Emotionless masturbation, the silent relationship killer. A man once sat across from me and said, "Dr. Rena, I still feel desire. I still get urges, but when I'm done, I just feel empty. I don't feel better. I feel more alone." He paused and looked away before adding, "It's not even about sex anymore. It's just a habit, something I do out of boredom or stress. But it's like there's no soul in it." That quiet confession has stayed with me for years because it speaks to something almost no one is talking about: the emotional damage that happens when self-pleasure becomes completely disconnected from meaning, connection, or care. At a certain point, many men, especially after 70, begin to drift into patterns of masturbation that are entirely mechanical. There's no fantasy, no imagination, no memory of love, no emotion, no warmth. It's just a release, like checking off a box or turning off a pressure valve. And the truth is, while that might feel harmless in the moment, over time it begins to rewire your brain and body in dangerous ways. When arousal becomes detached from intimacy, your brain lowers its production of dopamine, oxytocin, and even testosterone. You stop getting the neurochemical rewards that once made climax feel uplifting and energizing. Instead, you feel more tired, more numb, more withdrawn. You start associating pleasure with isolation, not connection. And worst of all, you lose the ability to bond. The price? It's bigger than most men realize. I've seen long-time marriages grow cold, not because the love was gone, but because one or both partners no longer felt emotionally present. I've seen widowers withdraw from potential new relationships, not because they didn't want to love again, but because their private habits made intimacy feel distant or unnecessary. And I've seen men who once shared affection and joy in their relationships slowly drift into emotional silence, all because they replaced connection with routine. That silence is deadly because over time, it leads to loneliness. Not the kind you notice right away, but the quiet, creeping kind that sits with you during breakfast, lingers in the empty bed at night, and eventually makes you believe that your days of intimacy are behind you. I don't say this to shame you. I say this to wake you up, because you deserve more. Masturbation doesn't have to be mechanical. It can still be a space of tenderness, memory, fantasy, and even healing. You can bring in thoughts of someone you loved. You can slow down, breathe, and allow yourself to feel something deeper than just release. You can retrain your mind and body to crave connection again, not just relief. I tell my patients this often: the body may age, but the heart doesn't. And when you honor your sexuality with care and presence, it can become a source of emotional strength, not isolation. So, what's the solution? It's not to stop, it's to soften, reconnect, bring soul back into the experience. And now that we've uncovered all four mistakes, the physical, the mechanical, the muscular, and the emotional, I want to bring it all together for you, because there's one truth that ties all of this together. And if you hold on to it, it could change the way you experience your body, your relationships, and your life in the years ahead. Let's talk about that now. Conclusion. If you've stayed with me this far, I want to say something from the heart. Thank you. Thank you for having the courage to listen, to reflect, and to consider that maybe, just maybe, the way you've been approaching something as personal as masturbation might need to change. Not because you did anything wrong, but because no one ever taught you how to care for your aging body in this way. We've covered a lot today. The first mistake, rushing through the act like it's just something to get over with, robs your body of healing, balance, and calm. The second, using too much pressure or force, slowly desensitizes your nerves and makes real intimacy harder to enjoy. The third, ignoring your pelvic floor, weakens the foundation that supports your erections, your bladder control, and your sense of physical confidence. And the fourth, letting it become emotionless, slowly builds a wall between you and the very connection your heart still longs for. I've seen these patterns play out in countless men. Some didn't know any better. Some thought they were just adapting to age. But many told me once they made a few intentional changes, their body began to respond again. They felt more in control. They felt more connected. Some even said they felt more alive. That's why I believe this message matters, because it's not just about sexual health. It's about your identity, your dignity, your power as a man, not in the sense of performance, but in the sense of presence, awareness, vitality. You're not broken. You're not past your prime. You're just in a new chapter of life. And this chapter doesn't have to be marked by decline. It can be marked by growth, wisdom, and yes, even pleasure, when approached with care. So if something in today's message resonated with you, don't let it slip away. Start making small changes. Slow down, use your breath, engage your muscles, bring in memory, bring in heart, because your body is still listening, and it's never too late to reclaim what's yours. Thank you for letting me walk with you through this conversation. Until next time, take care of yourself. You've earned it. If this message spoke to you, don't keep it to yourself. Give it a like, share it with a friend who might need to hear it, and leave a comment below to let me know what resonated most. Your voice helps others find the guidance they've been missing.